Hello, I'm Dr. Andrew Neville. I specialize in treating adrenal fatigue and related chronic illnesses. And today I want to talk to you about an incredibly common complaint that my patients with adrenal fatigue will have, and it's that of depression. Now, straight up, most of my patients are depressed because of this condition, not necessarily they have the condition or the other symptoms associated with the condition because of depression. See, in society today, depression has a purely psychological connotation. And partially that's true. I mean, there are psychological patterns, and we all are different biologically, and our neurological mechanisms work differently. So there is a psychological piece of it, but not all. So today I want to talk about maybe a different way to view depression in and of itself, because there could be lots of other reasons. Some of the strongest research on depression is actually associated with cortisol and depression. We know that high levels of cortisol from a stress response, high levels of cortisol are linked to depression. There's a lot of change, there's a lot of biochemical change that happens in the brain when the body is in a stress response, right? So if you've seen some of my other videos, basically a stress response that's overactive, stress response system that's overactive, associated with adrenal fatigue, right? Dumping all that excess stress hormone leads to a certain set of symptoms. And it's incredibly common. Some people have most of them. Some people, many, have all of them, whether it's fatigue, pain, weight, insomnia, brain fog, anxiety, depression, blood sugar problems, blood pressure problems. Every one of those, if you look through the conventional research even, every one of them has links to chronic stress over time. Now, most of my patients are treated, by conventional medicine, at least initially, right? And they'll come into me and they've been on various antidepressants. It's one of the most common drugs that my patients will be on. And there's a fair amount of experimentation with those. I mean, at best, they're working, I don't know what it's 30 to 40% of the time if you pick the right one. And there are side effects and problems. We all know about the challenges with some of those medications. If, let's say somebody picked the right one, right? And you come in on whatever it might be, some SSRI or something, and you feel better. And that's fine to feel better. All you've done though, is you've covered up the symptom. You still haven't fixed the underlying problem. This underlying physiologic shift is still occurring. So you've covered it up. You've kind of put a Band-Aid over or a piece of tape over the check engine light in your car, because this pattern is going to get more and more ingrained. And eventually those antidepressants tend not to work anymore, and then you got to switch to another one. Meanwhile, excess wear and tear, not enough healing and repair happens continually, right? And this is not a good equation for good health and well-being. Now, there are multiple reasons for the depression that my patients will feel, whether it's cortisol or adrenaline and damage that happens, whether it's a depletion of some of those feel-good neurotransmitters because of the stress response, which happens as well. Sometimes it's blood flow issues, because of the kind of blood volume issues that adrenal patients have. If there's not enough blood going to the brain, the elevator's not making it to the top floor, right? And that can lead to problems like that. Even there's association with another adrenal hormone called DHEA and mood and depression. Sometimes it's even just a fatigue, just a flat out lack of energy, which also happens with this, right? Damaged mitochondria, lack of energy, and just a decreased motivation, right? A decreased passion. There was there's association with chronic fatigue syndrome and adrenal fatigue, of course. So I would attend these international chronic fatigue conferences, and there was a really bright psychiatrist who specialized in chronic fatigue syndrome, which is really just adrenal fatigue kind of to the nth degree. And he said you can pick out somebody who's got depression apart from somebody who's got chronic fatigue syndrome. Just ask them one question: what would you do if you got better? And he said, I wish I thought of this, right? But he said people with depression, they can't really answer that question, right? They'll hem and haw and well, maybe I do. No, I don't think well, maybe, nah, I don't know. I'm just not sure, right? Whereas if you ask somebody with chronic fatigue syndrome, right, or adrenal fatigue, what would you do if you're better? I mean, you better have an hour or two to sit back and listen to this big laundry list of stuff that these patients want to accomplish. And that tends to be a little bit of the difference between the psychological side of depression and really just a biochemical kind of mechanistic issue with regard to depression. So depression is real and it's a thing. I'm not saying it's not, but what I'm saying is there is quite possibly a different underlying cause that's feeding that symptom. And if we were to fix that underlying cause, not even if, because I've seen it happen hundreds and hundreds of times, when you fix that shift, then these symptoms gradually just go away. Even just recently, I had a patient, this was probably about 6 weeks ago, in a group, and we were talking, and she was skeptical. I remember her first conversation. She was skeptical and she was down, and it was a little challenging, kind of talking things through with her. And I think it was within 4 weeks, she was shifting, and she was surprised. She was shocked, and she shared this with me. She's like, I was surprised. I've tried so many different things. I've been burned before, and nothing's ever worked. She said within just 4 weeks of kind of working together, I was smiling more. I was less skeptical. I had hope, right? And that's quick, right? That's quick for her to rebound in that way. But even she was surprised. I was a little surprised myself too. But when you shift your physiology away from the wear and tear and turn on the healing repair, all bets are off. Amazing things can happen. The body knows how to heal itself. We just have to turn on that physiologic state. And when we're stressed out all the time, whether there's current stress now or stress of the past, which is wired our limbic system, and now we're stuck in a stress response, either reason. But when we're in fight or flight all the time, we're shutting down all that healing physiology. Truly, the cell's ability to heal itself is shut off. Turn that on. Sky's the limit. Sky's the limit. I hope this helps. Any other questions? I've got other videos on the channel. Just click the link in the comments below. And I wish you all the best.